Welcome to certification course on enteral nutrition by Suchitra Mohanraj. So the course content, the modules are introduction to enteral nutrition, enteral access devices, enteral formula, disease specific nutritional support, complication of enteral nutrition, refeeding syndrome, and enteral nutrition monitoring, gastric residual volume, pediatric and enteral nutrition, and case study on critically ill patient with EN support and a pediatric patient with EN support. Module 1, Introduction to Enteral Nutrition, in which we'll look into the definition, principle, nutritional assessment and care process, and indications of enteral nutrition. In Module 2, we will look into enteral access devices. In this module, we'll cover factors to be considered for enteral nutrition access and what are the routes for enteral nutrition access. Module 3 is of enteral formulas, in which we'll look into what is polymeric, hydrolyzed, elemental, blenderized, and modular formula. So in Module 4, this is specific nutritional support, in which we'll look into immunonutrient and modulator and EN support for sepsis, trauma, burns, renal failure, hepatic failure, and SIRS. In Module 5, we will look into the complications of enteral nutrition under these categories of gastric intestinal complications, mechanical complications, metabolic complications. Module 6, we will look into what is refeeding syndrome, definition, pathology, pathogenesis, etiology, symptoms, diagnosis, treatment, and ways to reduce refeeding syndrome. And in Module 7, we will look into enteral nutritional monitor, in which we'll look into monitoring of biochemical parameters, monitoring of what are the things we monitor in patients on enteral feeding. In Module 8, we'll look into gastric residual volume, definition, GI dysfunction and GRV, and when and why it is necessary to monitor. In Module 9, we will look into pediatric enteral nutrition, in which indication and contraindication of EN, site and mode of delivery, principle of designing and monitoring pediatric enteral nutrition. Module 10 is of case study on critically ill patients with EN support, and Module 11 is on pediatric patient with EN support. Thank you. Let's meet on Module 1.